I'm Alan Clear, the Executive Director of the Harm Reduction Coalition. We're a national organization based in New York City and Oakland, and we focus on harm reduction as relates to drug use and drug users. We've been around since 1994, focusing on policy and advocacy work, training and capacity building for organizations that work with drug users, putting out publications, and every 2 years we do the only national harm reduction conference. So some of the things we've been working on lately are lifting the federal ban on the funding of syringe exchange, looking at how we can reduce overdose fatalities amongst drug users, getting a funding stream for hepatitis C so that drug users can get hepatitis C addressed, and getting access to low threshold buprenorphine. At the drug policy conference, probably the overwhelming majority of people here are more interested in marijuana than they are in drug overdose or syringe exchange and HIV prevention. But I don't feel marginalized in the way we used to years and years and years ago. And we're much more integrated, I think, into the larger movement in some ways. But in terms of media, we have very specific issues, and I think all reform groups work through their different media outlets, and media is very receptive to looking at science more reasonably lately. So they'll look at marijuana, medical marijuana, but they'll also look at the effectiveness of syringe exchange. They'll look at drug user health issues. They'll look at prison reform. So I think there's very fertile ground for media, and I certainly don't feel the marijuana reform and harm reduction in any way conflict with each other. I think they're very often conflated in some ways, which isn't sometimes helpful. But I don't feel like we're adversaries or anything. I think it works well together. Yeah, our conference takes place every 2 years, and our next one is in Austin in November next year, November 2010. And we focus on the harm reduction aspects of drugs and drug use. So we are very practical oriented, so a lot of programs will talk about the work they do, and then that gets translated into other parts of the country. Other people adopt those ideas and finesse their programs. We look at policy and advocacy work because I think, like all the reform movements, it's a very grassroots oriented movement, the harm reduction movement. So people will be looking at different ways to organize, looking at our successes in some ways, looking at how we do what we do better. And we also do a lot of training and technical assistance workshops, which you don't get at a lot of conferences. It's, there's a lot of how-to with our work. It's in some ways our audience is much more of drug counselors, social workers, researchers. We get a broad cross-section coming to our conference, so it's very hands-on, and it's very community-oriented too. A lot of drug users from the community will be there at the same time as we'll have government officials and academics there, and we see that they're all important in the discussion. There was a case not that long ago, maybe 2-3 years ago now, where over 1,000 drug users died because someone cut heroin with fentanyl, whether it's homemade fentanyl or whether it was diverted fentanyl from some pharmaceutical company. Over 1,000 drug users died, and that was from Detroit down to Wilmington, Delaware, which garnered no media whatsoever. And if that had happened to anyone going to a Wendy's and having a burger and getting hepatitis A, I think we would have heard all about it, which shows you the value of drug users' lives. But people didn't know what they were buying in that case. And fentanyl is an opiate, and it is a strong painkiller, and whoever cut the drugs thought it was a good idea, more profit, and people would be happy with it, but it killed a lot of people, and we see that all the time. I was talking to a drug user yesterday, said they enjoyed taking drugs, they just didn't enjoy not knowing what was in it. And you take away the black market, and you do away with that. On the other hand, one of the big issues right now is prescription drug use and diversion of prescription drugs. And they actually do have a quality control. So, we need to get a handle on the way people use drugs and the drugs they use. And obviously, if people taking pharmaceuticals, they actually do know what they're taking. and it's still problematic use amongst those people. New Mexico is one of the most progressive states when it comes to harm reduction. There's needle exchange all over the state and overdose prevention. Harm reduction is a philosophy that's embraced by the State Department of Health. And it shows you that an idea like harm reduction is nothing to do with rich economics or poor economics. It's about good sense. And New Mexico sees it with its not very strong economy as a way to actually save money, but also save lives. But the absurdity in some ways of making it difficult for someone to call 911 out of fear that they will be arrested is, it seems you would think would be apparent. You know, we have seen people arrested and charged with murder because they were at the scene when someone has overdosed from you know, an injection of heroin or whatever. And New Mexico, to take a proactive stand, change the law, make it safe for someone to call 911, saves lives. And, you know, our intolerance of drug use and our attitude towards drug use shouldn't extend to the place where we're willing to let people die as a consequence of their drug use. And the Good Samaritan laws are, you know, a step in the right direction. You know, we need a compassionate response, not a punitive response. The hesitancy around starting a syringe exchange program, you know, is really, you know, not understandable in this day and age. You know, it's based upon fear and it's based upon a perverse sense of morals, actually. It's not based on any Christian values or any, you know, faith-based values. You know, opposing syringe exchange is really pretty much like believing the world is flat. We've reached this point now in our reform movement and in harm reduction and, you know, and all the other drug reforms, where we have a sense of optimism. I think what we've had for a long, long time is a whole set of challenges, and we feel, I think, that with a more enlightened political environment, that change is possible. And I think we see that with the lifting of the federal ban on the funding of syringe exchange, which we hope will be sent to the, you know, the dungeons of history in a few weeks, and that we will be able to use federal money for syringe exchange. You know, we're seeing good signs from the drug czar, Gil Kulikowski, that things may go off in a different direction. At the moment, it's just language, but, you know, hopefully we'll see some action after that. So I think this is a very positive era we've come into, and what I think pays off is throughout the years of, you know, the different Bushies and the Gingrich Congress, is that we did our work, we did our homework, we did our science, and we rolled our programs out, and we learned a lot. And now all that knowledge and all that experience is coming into play, and we had to really think about our arguments. We really had to rehearse how we present ourselves and talk about our work in a particular way, because it was about communication. And I think now we have this set of expertise, and it's going to produce results. You can go to our website, and if you go to www.harmreduction.org and you look under community, you'll find our conference. It's all listed there, and people should submit their abstracts. We encourage people to come to the conference and speak about the work you're doing, and talk about yourself and talk about your work. And it's not an elitist conference, it's a very friendly grassroots conference.